welcome. Very good afternoon to all of you. This is a special show that we bring to you. Now, remember, all of us have been urging viewers across the country to stay home and to stay safe. While some of us are fortunate enough to do that, there are many others who are facing difficulties during this confinement period. But the good news is that there are certain good Samaritans among us, the do-gooders, who are reaching out to those who are finding it difficult to survive during this period. So this show is dedicated, and as we go on, we will bring more stories as well. And today is the first episode of this particular initiative that we are taking to highlight stories of good Samaritans who are working on ground tirelessly to reach out to the needy, to the underprivileged, and to the elderly. So let me introduce my guests on the show today. My first guest is Chinu Quatra, who's a 29-year-old social worker from Mumbai. Initially, Chinu wanted to join the Indian Army, but later he decided to begin an altruistic service, an altruistic organization called Khushiyan. Now, Khushiyan normally, of course, works in other areas like cleaning up beaches, providing sanitary napkins, and providing shelter to stray dogs, feeding the underprivileged children. But in these circumstances, Khushiyan has started an NGO called Roti Ghar, and which is why we have decided to feature Roti Ghar today in the program. This project provides food to underprivileged children in Mumbai and also trying to reach out to children in Bengaluru, Odisha and Hyderabad. Chinu Quatra, welcome to the show. My next guest today is Shishir Joshi, from the CEO of Project Mumbai. Again, lending a remarkable service to people on ground who need help, especially the senior citizens. Project Mumbai has 1,500 volunteers, and they serve senior citizens who are living alone or who are quarantined. Remember, those couples who are quarantined, not able to step out, getting them daily supplies is something which has been an area of concern, and Project Mumbai is addressing these concerns at the moment, partnered with D-Mart, Star Bazaar and medical firms to supply grocery and medicines to the senior citizens on a daily basis. They are carrying kits to these senior citizens with ration and dental kit and soap. So I would like to welcome Shishir Joshi on the show to talk to us about Project Mumbai. And also, in fact, Project Mumbai, I'm told, serves food to doctors and the staff who are attending helplines. So really highly appreciated the fact that Project Mumbai is doing this kind of service. Let me also introduce my third guest on the show, Mahita Nagaraj of Caremongers India. Again, Caremongers was featured in Mirna earlier as well for the kind of work they are doing on ground to help several of those citizens amongst us facing difficulties during this lockdown period. When the entire country has come to a grinding halt, 38-year-old Mahita Nagaraj has started this initiative to reach out to the elderly in particular and those with special needs. So this is important. Clearly, many of us know that there are elderly citizens who, because of physical difficulties, are confined and cannot step out. So Mahita was quick enough to launch a Facebook group. In 48 hours, it in fact saw 2,000 members, and a helpline also set up, and it receives apparently 400 to 450 calls per day. She, along with other volunteers, drops off essentials to the residences of people that she's identified as those who are in need of deliveries, home deliveries at this point. So I would like to talk to my guests on the show today to understand how they are going about this, these kind of projects that are meant to help the needy. Can I come to you, Shishir, first, because this is a Project Mumbai that we are talking about. I believe you have 1,500 volunteers. First of all, tell us what inspired you to take up a project like this. I know you were a former colleague, you've worked as a journalist, but to come up with something like this at a time like this is just the need of the hour. Now, tell us what inspired you to take this up.
I think it's extremely commendable work that not just Chinu and Ms. Nagraj are doing, but so many good people are doing lots of good work, and that's the need of the hour. I've been part of the state support system, and I realized that there is a lot of good work that the state machinery at the municipal level has been doing. What we did was, at a very early stage, decided to identify what are the gaps, what the citizens require. And these gaps we began addressing and we spread the word, and we were fortunate that citizens have risen up to expectations. So while the first of the initiatives that you spoke about, assisting senior citizens who are home quarantined for personal reasons, providing them medicines and food was the first one. What we also did was we also set up a mental health helpline, a counselors on call. We've got 50 trained mental health experts who are now reaching out to people. They're all available from 8 in the morning till 8 in the night. We've also set up a similar program for people with special needs. These are 30 counselors that are doing that. We also have, as you said and pointed out, the JJ Hospital, Hospital, the Cooper Hospital, and hospitals in Navi Mumbai, close to 3,000 doctors that we are providing meals to. These are frontline warriors that we need at this point. And we've started reaching out to people who are homeless and special communities. So, beginning this evening, we'll also, there's a very strong Northeast community members in Mumbai who are in the service sector. The sector has shut down for the last few days. We are providing them grocery bags. So, we realize there is a gap. We feel that we have the strength of people support, and we just decided to marry people's support with energy and people's desire to do something. And Project Mumbai has been there. We are happy to help.
Well, really commendable the kind of effort that you are making to reach out those who are in need of your help and assistance. It's a humanitarian cause, and of course, we should extend our gratitude to someone like you who is doing this work for all of us in that sense. Let me just also bring in Chinu Quatra now, who runs Roti Ghar, which is providing cooked meals to those who are not able to step out or those who are physically unable to handle their work. Maybe sometimes because the house helps, the domestic help are not coming in. So many of those cases we've highlighted. But Chinu Quatra, you run Roti Ghar, which is based in Mumbai, but you're also catering to other cities now. Tell us, how did you conceive of this? When did you conceive of this? And at a time like this, how are you operating?
Yeah, so basically, Rotigar was started in 2017, 5th December. The first location was Thane, and the idea was is to provide meals with love and nurturing to the underprivileged kids. So till date, we have completed 2 years, 3 months now of Rotigar project under Kushia Foundation. We have expanded with the help of Ananta and Excellency to Bangalore, Odisha, Hyderabad, and Mumbai. We are doing Bangalore, Odisha, Hyderabad, and Mumbai. So we were feeding 1,000 plus kids
Right.
till date. But due to this COVID, on to 24th of March, I got a message through by Priyanka Chaturvedi ji, MP Rajya Sabha and Shiv Sena leader, that we can our kitchen, which is already running, can help the migrant workers and the below poverty line people in Mumbai. So, and that was the time I was at Delhi airport, and I gave her the green signal that we can definitely do it. We have a capacity of making 10,000 meals a day. Our kitchen starts at 4 a.m. in the morning, shuts at
Okay.
12 a.m. in the midnight. So the kitchen is led by my own mother, and she is helping the cooks and the other people there in the kitchen area. My other team is who are working from home. They are handling as a call center and a back end support, so that we whatever calls we are getting, requests we are getting to provide the meals. There are 8 people on the ground on the field who are running with the 4 vehicles right now and providing the meals, daily meals to the people who require right now.
All right. Let me introduce my third guest, Mahita Nagraj, who joins us at this time. And this is an organization called Caremongers India. Mahita, how are you dealing with the current crisis? Because obviously, at a time like this, that like we just heard, migrant laborers are the ones who need most help, and then comes the underprivileged lot who do not have access to the daily income. Some of the people that we're talking about today, I believe Caremongers have taken this initiative to reach out to a lot of them. Can you tell us how are you operating really, and who are exactly are the people you've managed to reach out to so far?
So thank you for having me on the show. I'm so deeply appreciative of the work that both Kushia and Project Mumbai are doing, and I'm very inspired by them. So Caremongers is just a group of volunteers from across India. We are a Facebook group that's over 24,000 people strong now, and the idea behind caremongering is that in this current scenario where there is so much panic and fear being spread, everybody can chip in to do whatever they can do to assist their individual communities. So whether it is in terms of providing information or in terms of networking with somebody else in a different city, or actually physically going out and running an errand for somebody in your community or close by, these are some of the ways that people on our group are helping. In terms of supplying ration or food to underserved communities or stranded migrant labor or people in the slums, we have information of verified NGOs that are working in different cities across India, and we try and put people in touch with them. Um, as caremongers ourselves, we run a helpline where people who are
Right.
vulnerable, senior citizens, the physically challenged, people with medical needs, or people with infants, anyone who is immunocompromised, can reach out to us for any sort of assistance in their locality, whether it is to supply them with medicines or supply them with provisions. And in fact, we have moved now to a system where our volunteers reach out to them on a weekly basis to find out if there is anything that they need. A lot of the time, these people are in need of nothing more than a friendly voice, somebody to check in on them, to see that they are doing okay, and that that their needs are being met. So of course there are a lot of heartwarming cases
Right.
of assistance proffered on the group, and it's just wonderful to see that so many people have this overwhelming desire to help, and that they are doing so in this
Yes.
time of crisis.
Right, and like you said, people are calling in, and you're willing to, take them in at a time like this, when, of course, like you said, there are a lot among the lot of people among us who simply need a soothing voice, perhaps, to talk to. I want to ask this question to Shishir as well: that how are you managing the part about how to or who should be the most deserving to provide the kind of assistance that you are, because clearly the numbers in a country like ours is huge. So is there a process by which you identify, you do your kind of screening or sorting in any way?
Yeah, sure. Afrida, one, we purely go by trust. Somebody who's calling out is calling out in times of need. So we call them, we ask them. What we've done is two processes. Just a simple example of somebody who's a senior citizen living alone. We ask them the relevant questions, that if they're alone, are there family members living nearby? And if you can speak to them. So if a nearby family member can reach out to them, that's
Okay.
one. We've got calls from different parts of the world asking them that our parents are here and can we reach out to them. What we've also realized, most of these senior citizens living in Mumbai now, there are several of them living alone. The maid servants or house help have left because they are not working now. So even they don't need grocery, they need somebody to cook. So we're now providing them with home cooked food. That's one of the other areas. Far more important, Afrida, what we felt apart from sorry, senior citizens and uh, this is two initiatives. One is on mental health, and that is something I wish if you can share this to people. It's there on our website, projectmumbai.org. We've got 50 trained professionals helping people to tend to their concerns. People are stressed now, people are worried, people are concerned. So that's one specific category we are looking at, trying to reach out to people. The second is there are families who have members with special needs, children. And in this case, we are reaching out to these families. They can reach out to our therapists who are available from 8 in the morning till 8 in the night in 8 different languages. Call them, reach out, vent out your feelings, unburden yourself, because these are trying times, and we'd like to just share with them that we are there to help. And the last, which we plan to start today, is a free delivery of grocery and medicine service for people with special needs and persons with disabilities. So, but living alone, because these are people with some challenges who may not be able to step out. And we are trying to reach out to them, answering your questions.
Yes.
We just go by trust and helping them to say that if they're genuinely alone at home, first is to help them out. That's our first effort always.
Yes, Shishir, you said something very important about how you're also taking care of the mental aspect, that certain people may not even need any assistance in terms of food, but they need somebody to, and to use your words, unburden their feelings. And it can happen, of course, especially, living in isolation, living in a quarantine situation for a very prolonged period. People do need outlets. If I can also now, talk to Mahita about this. You were mentioning how there are a lot of challenges as well in making something like this function smoothly, because the government has a tough balancing act. On one hand, there are restrictions in movements, so obviously only very few people who have that kind of a pass. In some states, they have the e-pass or the essential services pass, can operate. Are you having any such operational difficulties?
Like you very rightly said, there is a balance that needs to be struck between adhering to the government's request to stay under lockdown and prevent the spread of the infection, while also making sure that the needs of the vulnerable citizens are met. This is one of the reasons that we've moved to our weekly delivery system, so that we are able to cater to the needs of people who are alone or who have no other assistance available in and around them, while also ensuring the safety of our volunteers. So, in some cities, we have been able to work with the authorities, procure passes for either vehicles or volunteers who are out making purchases of medicines or essential supplies for these senior citizens. In most states, also, I believe the authorities are extremely cooperative in that they understand that if an errand related to medical supplies or provisions is essential, then they are allowing our volunteers to function as well. Having said that, I do believe that our
Right.
volunteers are using their discretion in terms of being able to balance exactly the problem that you mentioned earlier.
Right, right. Okay, there is some disturbance in your line, but yes, I got your point that you made about how the volunteers' protection, even they who go to the doorstep, their safety also has to be taken care of. Chinu Quatra, did you face any such challenge? Because again, we are hearing that even when these deliveries are being done, it has to be contactless delivery. Certain precautions have to be taken. You have to make sure that your own network of people who are out there doing this kind of service are also observing all the necessary precautions, because this is a time where human to human transmission is the biggest threat. So while you do your job, are there certain precautions also that you are taking and you are observing very strictly?
Challenges are definitely there at this particular time. When we are out and when we are going for the delivery, we are maintaining what our government is saying, what our doctors are saying too. My few friends have already, the who are doctors, who have already messaged us what all precautions we need to take there. And in case of calcium deficiency or any vitamin deficiency, we can have whatever things we can take care of about our own self. More than that, the police of ours is helping us to overcome these challenges. So wherever the distribution is happening, especially in the slum areas, they are taking care. The distance is maintained. The food is being given at a particular distance, so that they don't have to travel to us and make a crowded place gathering. Especially in Mumbai and Delhi too. Delhi, where Kala's Kitchen is providing us the meal, the Delhi police is going themselves and delivering the meals to the people who have required. In Mumbai too, Mumbai police is helping us to the core. Bangalore police has provided us the all the essential services passes, as well as they are traveling with us to provide these meals. So the police is the major
Right.
key role player for us right now.
All right. At the same time, I want to ask Sishir if you can take this question up on how, at a time like this, of course, you are directly in touch with people who are in distress, obviously, and therefore you're reaching out to them. What are the problems that need immediate attention on the part of the authorities? Because even though the government claims that enough is being done, since you on a day-to-day basis interact with people who are facing difficulties, from your side, would you like to point out certain problems that need immediate attention in the larger picture, in the overall picture of India's fight against COVID-19?
I think Afrida, Mumbai has faced the 26/11 attacks, and this is almost like 100 times more of what we've seen. So suddenly, we've all been hit by something which were not prepared for. And in a space like this, what is needed is mapping of resources, which one somehow feels could have been done better, but where that gap of mapping has been completed is where citizens have come forward. We've seen three of them, two of them here, other than me, but there are hundreds of them doing fantastic work. And if I could offer you a peek into our email ID, which is volunteer@projectmumbai.org, every minute, the last 15 minutes that I've been on air, I've got 20 emails from people from different parts of Mumbai to say, this is my number, this is the area I come from, I'd like to help out. Tell me what I need to do. I have a car, I have a bike, I can walk around. And that shows that people, despite the adversity, that the threat to their own lives of health, they are willing to step out and do things for others, and which is remarkable. So yes, there is a gap. That mapping could have been far better, but institutions have come forward, and that gap is being filled by citizens. We all need to bear. We all need to fight it out.
Okay. Yes, it's absolutely heartening to see civil citizen groups, NGOs, ordinary citizens in many cases coming forward simply to help completely selflessly. Mahita is, of course, one of them. And Mahita, I'll give you the closing comments now since I'm running out of time. Just quickly, if you can highlight for us in the larger picture, today India is grappling with the worst health crisis like the rest of the world. Of course, we are perilously close to a figure of 2,000 now. In the overall picture, from your understanding, what are the loopholes that need to be plugged?
I think exactly like Shishir mentioned earlier, there is a large gap that needs to be addressed between demand and supply. The lockdown has left a lot of citizens in the lurch because the way India functions is that we rely on other people for assistance. I think in the absence of daily workers, whether they are maids, whether they are drivers, whether they are migrant labor, whether they are people that come from the slums, whether they are people that are part of the government, Paura Karmikas who are, sweeping the street. The onus is now on the citizens to come forward and ensure that not only they are safe and well and adhering to the lockdown, but also to ensure that the needs in their communities are being met. Like you rightly mentioned, it's very, very
Right.
heartening to see that every citizen is coming forward to do their small bit in whatever way they can. I think this is the premise on which the entire Caremongers India initiative functions right now. Over the last 10 days, we have fulfilled over maybe 1,500 requests across India. We have a group that is spread from Kanyakumari to Kashmir and Gujarat to West Bengal. So every part of the country is covered. And if there is anybody that requires assistance, you're most welcome to reach out to us. Somebody or the other will be there to assist you.
Absolutely. So it's because of people like Mahita, like Sishir, and like Chinu Quatra that today some of those gaps that we have are being filled, are being taken care of because people are reaching out with their help and assistance. I would like to thank all my guests for joining us here on Mirror Now this afternoon and sharing their experiences with us. And this would be, of course, a big motivation for many others also to come forward and help in whatever way they can, of course, while strictly observing the lockdown rules. Thanks for watching this episode on the Good Samaritans.